Hello, everyone, and welcome to the ZeOmega webinar, Aligning Quality and Value to the Whole Person. Today's agenda, we'll start with introductions to our speakers, then care and quality from a ZeOmega's perspective. Next, an introduction to care reminders, proactively managing gaps in care using care reminders, and an introduction to Campaign Manager, running targeted member outreach campaigns using Campaign Manager. Our speakers today, Tricia Swift, Vice President for Clinical Transformation of ZeOmega, Sandra Hewitt, Chief Nursing Officer with ZeOmega, and Matt Adamson, Vice President, Product Planning and Innovation. Tricia Swift came to ZeOmega in 2019 from the management consulting industry, where she provided advisory services and executive coaching for hospitals, healthcare systems, healthcare architects, and software vendors. She brings a variety of experience in areas such as strategic planning, performance improvement, healthcare quality, regulatory accreditation, and value-based care initiatives. Tricia is a doctor of nursing practice and is internationally certified in the science of patient safety. As the Vice President of Clinical Transformation for ZeOmega, Tricia leads efforts to develop organizational strategy for value-based care and ensures our Jiva platform is utilized to enable practice and operational transformation. Additionally, she develops platform strategy for care transformation, oversees our RFP department, and leads the advisory services vertical. I'll turn it over to Tricia Swift.
So much. I thought it would make sense to get started here, just orienting ourselves around the definition of value, since the trend in healthcare is to move more towards value-based care. And many times we associate value with some sort of contractual agreement, which is pulling us away from the true intent and definition of what it's supposed to represent. So when we look at value, it's really speaking to the shift that we all must take to integrate quality and cost. And when we zoom in on what that looks like, quality has a definition that includes outcomes, patient experience. And patient experience is looked at, first of all, the member's perception of quality, in addition to the care team's experience with how they deliver care to the patient or the person. As we look at how quality has been rolled out operationally and how health plans and organizations want to manage quality, we've tried to align ourselves under programs like HEDIS and STARS that kind of provide some governance and some guide rails for us on meeting certain measures that when they're met, they're supposed to translate into quality. And right, wrong, or indifferent, some of these efforts to become compliant and to align ourselves with the triple or quadruple aim have led us to a state of just chasing charts and checking boxes. And we all know that that's not necessarily the way that things were designed, and that doesn't necessarily lead us to value. What it's supposed to do is it's supposed to align behaviors, processes that when done, land us in a place where we're actually offering value for our consumers. So that's what this slide here represents, is just putting those HEDIS measures, putting those parameters under the triple aim framework, and really showing and demonstrating the alignment, intention of what these measures are supposed to achieve. So on the next slide, we're taking that a step further and looking at what the maturity curve plots out for us. So organizations typically start at the bottom end of this curve when they're building up what their quality program looks like, and they're starting the journey for offering value-based care. And most folks start at the bottom, where we're very tactical. We want those boxes checked. We're running around the last few months of the year, and the focus is really on bumping the scores. It's not necessarily a more strategic focus of actually improving outcomes of populations and coordinating care across the organization. But as organizations mature and move through the levels of maturity, if you will, we begin to see integration of other layers of competency, adding in retrospective analytics, where we actually analyze the data year to year and try to augment processes in between. Also pulling in a proactive outreach approach where we're trying to get ahead of measures and ahead of things that we're going to be held accountable to. So finally, we can land on this where we're functioning in this anticipatory coordination mode. And what that means to us at ZeOmega is when we're doing anticipatory coordination, we're encompassing an infrastructure that facilitates ongoing improvement. It's just the normal way we do things. We're effectively engaging patients, families, care teams, and consumers. And the focus isn't on bumping the scores, although acting in this way will do that. The focus is creating a high reliability, clinical excellence, and safety focused delivery mechanism that allows us to achieve that triple and quadruple aim. And the scores will follow. So we're more concerned of anticipating and solving problems in real time. Level view of the maturity curve. The next slide kind of zooms out even bigger than that. So as we think about how to actually solve this problem and how to actually get to offering value-based care, we have to begin to look at the whole person. And traditionally we're looking at complex case management, managing, multiple conditions at once, or very complex cases of patients that have multiple things going on, lots of medication management, need a lot of coordination, and we're doing that. But I think with the value-based care trend and the movement towards value-based care, whether you're on a contract or you're not, acknowledging that all patients deserve to have care that's aligned to value. And in order to do that, we have to recognize that 40% of things that drive health and wellness is related to socioeconomic factors. Only 20% is related to the quality and access of healthcare that's received. So if we broaden the way in which we begin to care for members and consumers of healthcare, we have to begin to focus on the things that are in their environment and the behaviors that the individual participates in, because those two combined make up 70% of what's driving the health of the whole person. In order to start focusing on the different end of the pyramid, if you will, and start to balance what complex case management looks like, in addition to driving wellness and health and keeping low-risk patients in low-risk categories, we have to begin to look at a strategy for engaging the whole person. And that's what we are looking at on the next slide here. So engaging the whole person involves a few different areas of focus. And really, all of these bubbles here are getting to the core of what manages to me. And when I say me, I'm putting myself in that health consumer category. So when we look at confidence, people feel a sense of confidence when they experience success. So when they're not successful, they can still feel confident if they receive clear and encouraging feedback on how to improve their health. Confident and competent patients are armed with a set of skills that can be applied to their health challenges, while a supportive care team stands ready to offer appropriate and helpful evaluations. So that's what confidence means in this particular model. When we look at connection, people who feel connected to others not only feel like they're part of a community, but they feel recognized and they feel understood. So they can reach out to others in support in a way that can advance their health goals. So when we look at this idea of connection, it's really the basic need where interprofessional and interpersonal dynamics between the provider and the patient become most critical. The patient and the member have to connect to their care team and to their provider in order to be in a position to effectively manage their health. Finally, ownership. So this is where things can get a little tricky because our healthcare system hasn't always supported the individual's piece of owning the outcomes of their care. However, when people take ownership of their health, they take action not only because they believe they should or they believe they have to, but it's because they want to. So that ownership, that sense of accountability comes from within. Many health behaviors, including modifying your diet or adhering to medications, may not be inherently attractive to own and be accountable for. But when patients begin to see those things as instrumental to achieving their health goals, they will organically develop that sense of ownership. Core, with the patient in the center, is how ZeOmega looks at engaging the whole person. And these bubbles around the person are different tactics, different strategies that we feel are essential for engaging that whole person. And they include giving the member choices and mapping the journey with them so they understand where they are, but more importantly, where they're going. Communicating in their preferred language and method. So as we look at managing members across generational spectrums and across ethnicities, we have to look at appropriate ways of preferred communication. Supporting the network that supports the member is extremely important. As we know, the social context is hugely influential in how we manage health. Education and teaching patients and members in the way that they're able to receive the information but doesn't overwhelm them. And then we start to shift more into incentive management and behavioral management, where we build on what that member is doing right in order to enforce their behavior. The most smallest things that they can do to make a difference, like perhaps 15 minutes of exercise a day is what's going to advance your diabetes care plan. Using lifestyle triggers to convert actions into behaviors. Those are some other things that certain cohorts of members respond very well to. And then finally, this sense of encouragement to, again, push that ownership and accountability to the patient to allow them to independently manage as much as their health as they're able to. There is there in the wings waiting to support them to fill in those gaps. So as we go through the rest of this webinar, we'll hit on these tactics for engaging the whole person as we talk to you about two of our solutions that we're quite excited to share with you today. So on the next slide, I'm going to touch on what the rest of the webinar is going to look like. These are the tools that ZeOmega is offering to help anticipate members' needs and help engage that whole person. So first of all, we have care reminders, and this is a solution that allows our users to proactively manage gaps in care, which can be regulatory based within HEDIS or not. It can also be custom measures as well. We have Campaign Manager, which is a way to outreach to patients through multiple channels. We can automate it and we can measure it. The idea here is that these two solutions together is really where the secret sauce is. We're proactively monitoring what our patients need so we can interact in real time or even ahead of the need. And then we have a very dynamic and customized way to engage them in being able to individually manage that gap or pull from resources within the care team to close what that gap looks like. So at this time, I'm going to hand it over to Sandra Hewitt to go over our care reminders in the section called Proactively Managing Gaps in Care. Sandra has joined ZeOmega in 2012. She brings over 25 years of experience as a pediatric nurse and a certified case manager in the provider, payer, and vendor domains. Before joining ZeOmega, Sandra served as director of case management in a large health system and a statewide health plan serving the needs of Medicare and Medicaid populations in Washington state. Sandra has also directed care management programs for the U.S. military's healthcare system. As Chief Nursing Officer, Sandra heads up the Clinical Intelligence Department and oversees development, use, and interpretation of clinical content and clinical intelligence. She also contributes to ZeOmega's population health management strategy and ensures compliance with all state, federal, and local regulations, laws, standards, and protocols.
Well, thank you so much, Tricia. I'm really happy to be talking today about proactively managing gaps in care, or really more importantly, managing quality issues before they become a gap for the patient. So closing gaps in care are quality measures, as I'm sure you're all aware, but also an indicator of appropriate care to a standard for the patients we serve. So I'll be going through several tactics that a platform needs to have before we can get to that proactive management. So in the first slide, we'll be talking about information consolidation in terms of how we enable top performance related to HEDIS and STARS measures. The first and most important aspect is really the data. The more data that you have, the better your ability to determine what is a gap. But more data is not always the only answer. So you'll need a sophisticated platform that will allow consolidation, integration of the data across many sources. Visibility of the members' data from multiple disparate sources needs to be considered and aggregated to the platform so the system, and more particularly the end users, can really see and share in the data that's available on these individual members. So here are some examples on the screen about Medicaid information, claims, data come from the EMR, et cetera. This is not an exhaustive list. These are just examples. And use of this data to construct identification and scoring algorithms is necessary to then properly assess risk and risk stratify patients, also to drive the workflow. So allowing multiple users visibility of this data, depending on the role that they serve, is an efficiency that any measure platform must support. In the next slide, the second enabler to top performance for HEDIS and STARS is providing that information to providers. So what we have at ZeOmega is a clinical quality dashboard, and I'll just show you in the next slide a sample of what that clinical quality dashboard looks like. This is just a tool that allows providers, depending on the quality measure, to really look at what those measures are, where they're looking in terms of benchmark per measure, and also drilling down to individual members in that particular measure to really see where they are and where they can improve performance. So having at the provider level a dashboard that allows these providers to see where their patients are and see where they are related to metrics is very important. But again, it's not terribly proactive, so we'll get to that in a moment. The next slide is the third point, which addresses, as Tricia was talking about, addresses some key actions that members can take to look at making a difference. What are they building on right now to reinforce behavior? So how the registries will assist the users dealing directly with the patients to really provide that information and supportive information to really reinforce behavior and encourage those next steps in managing patients that currently are non-adherent to particular measures. An example of a patient registry is shown in the next slide, which shows a list of members, a list of measures related to preventive health, and where they are. Is a patient compliant with some and not others? or is a patient completely compliant or just compliant in maybe one or two measures. And then that gives the end user who is talking with the patients the ability to really hone in on risks, behaviors for the patient as to why particular measures aren't met. The next slide is the typical gap in care, reports, data displays, etc. But again, this is after the fact, a gap has occurred, and we really want to get to that proactive state. So if you have a display that shows gaps in care, which we show on the next slide, you're ahead of the game because you do have visibility of a gap that has occurred. It does allow care team members to look and see if they can resolve it and actually meet a measure. But it is more retrospective than proactive. So the next slide will take us to where we want to go, proactively managing gaps in care. So we're calling this care reminders because it's not a gap yet. We're reminding the patient that there are care issues related to quality that they should help with. We build this into the care plan for the member, and that way we can address multiple items at the same time. So the next slide shows you our example of an operational dashboard that we've built into our platform that shows in advance where patients are with their quality metrics. So you can see that there are some measures that are overdue. These would be gaps in care. But then we also have measures that are going to be due in the next 60 days. This is the start of the proactive management that we have in our Care Reminders application. So you can see that if I just click on one patient, say the first one for eye exam, I not only get that this measure is overdue, but I get a listing of all of the measures that this is eligible for or needing to participate in. So I can not only encourage that patient to get their eye exam and close out that gap that has already occurred, but I can proactively talk with that patient about some additional services that they really need to attend to and get that addressed ahead of the game. So in the next slide, I just want to talk about what you would see. So having a dashboard that shows domains and measures, recommended frequency, clear visual cues, and a place to document is really what we need to have in terms of proactively managing all of these gaps in care or care reminders, so that you have greens across the board or everything is in a position where it is not going to be a gap at this particular point in time. You can see and plan. This should also be visible to the member so that they can start to set up their own plan for managing their own health. But it gives visibility across the care team so that everybody can see where the patient is in their care journey. And lastly, here are some of the values that Care Reminders will bring in the next slide. So you really want to make sure that the platform really shows that the person is in the center. So what matters to me is that ownership, the ownership of letting the patient know what is important to both the health plan, but their health and well-being, if they address all these measures and standards of care directly before they become issues. It presents information in a consolidated view for the member, for the provider, for the healthcare team, so that everybody's on the same page and can really support that member and give information that encourages the member to address their care themselves. Definitely supporting that proactive quality management. And the more data that you have, again, ahead of the curve, the less gaps in care, the more the benchmarks will increase. It improves those both HEDIS and STAR measure scores, and improves all around functioning. But one of the features that these care reminders also do is feed into other pieces of the platform. So what happens here is it's not just about one member receiving information. It's a group of members in the same situation that can then receive outreach services in a very proactive manner, very timely, integrating with other workflows, et cetera, and really helps, all this additional information really helps with those digital member engagement strategies, so that you can really reach a point where instead of providing a care plan for individual members, you're really providing their own pathway and their wellness plan, and starts to give that map of choices and maps the journey for that member. So I think the next section talks about, in our webinar, talks about outreach campaigns, which uses the information that Tricia talked about and that I just talked about in terms of care reminders, and talks about multi-channel automated measurable member engagement. So I'm going to be turning this over now to Matt Adamson, who's our Vice President of Product Planning and Innovation. So Matt's responsible for developing market-driven product offerings consistent with our company's long-term strategic vision. He defines product strategy, oversees our roadmap development, and leads product launches to ensure the success of ZeOmega's diverse clients. Matt frequently represents ZeOmega as a thought leader with clients at conferences and in industry forums and webinars. Matt joined ZeOmega in 2013 as Vice President of Product Management for ACO and Value-Based Healthcare. Prior to joining ZeOmega, he held a variety of leadership roles in sales and technology in healthcare IT. Matt received his Bachelor of Science in Management Information Systems from Eastern University in St. David's, Pennsylvania. So I'm going to turn this over to you now, Matt, to talk about automated measurable member engagement.
Great, Sandra. Thank you so much for that introduction. And hi, everyone. So glad to be with you today. Let's go ahead and get started on the next slide. So when you talk about campaign management, I think it's important to set the stage a little bit and describe why a population health management tool like Jiva, made by ZeOmega, would want to engage in something like this. And really, it comes down to a need to generate touch points with members, patients, healthcare consumers across the continuum. And it really is true whether you're working with a Medicare Advantage or a Medicaid or a commercial population. Increasing those touch points is really the key to helping improve your quality scores, of course, and improve the quality of the lives of the healthcare consumer, and lowering the cost of healthcare. As you look at this chart, the patients at the top, the 1 to 3% and the 3 to 5%, we feel like the process that our product supports today largely, and has for a number of years, where you have a care manager or a care coordinator or a health coach reaching their healthcare consumers they're responsible for via telephone. As all of you know, that becomes less and less of a reality, and less of something you want to depend on to be successful in a world where people no longer have home phones, and they're really looking at caller ID on their mobile phones as well. It's hard to get that outreach unless you're really sick and you see it as something that on a day-to-day basis is helping you. So as you look into that 5 to 25 and 75% area that is kind of underserved today using the call-out model, these are folks who are generally still holding jobs. They have families. They're very busy. They're managing their time, and they often take their health secondary to just getting through the day and getting done what they have to. So we have to attend to a reality where these folks need to be met the way they want to be met. They need to engage with a care management process in a way that's best for them, whether that's digitally, audio, or other factors. So I want to go ahead to the next slide and show some of the options here that we talk about in a world of multi-channel automated and measurable communication. The box on the left with a nurse care manager, again, or a care coordinator or a health coach and an ACO has a lot of information available to them through a platform like Jiva, whether it's coming in from an outside source or generated by the platform itself. Sandra already talked a little bit about care reminders and how differentiated forms of information such as claims and EMR and other clinical data points can lead to a process that can create care reminders for proactive care. Using that care reminder process, though, as a data point to determine workflow and communication channel is really what we're looking at here. So the idea of a care reminder, let's say, that is due 30 days from now, there are a number of options to get in front of that to make sure the healthcare consumer knows about that future care reminder so that they can get in front of it again and take care of that necessarily healthcare concern. You can either try to call them on the phone or you can try traditional outreach such as postal mail. Again, those are no longer in vogue in most populations. Even as you look at Medicare populations, everyone has a digital phone for the most part, a smartphone. So they want to look at things like live chat that could be initiated by them. They want secure messaging back and forth that can be handled in an asynchronous way. Video chat, if you have something that you'd want to talk to a healthcare professional about, maybe something you want to show them, or maybe it's beneficial in a behavioral health setting to see the face of that person so that you can get on a little more realistically and try to manage their care in that way. Push notifications are important for those with apps and mobile capabilities, and the ability to take those surveys. You know, one of the things that we struggle with as a PHM platform is we try to bring in data, the social determinants information, and where they are in their care, and really get answers to a number of assessments. Very difficult if you can't get them on the phone and get them to agree to be on the phone for 30, 40 minutes. So we want to offer different channels so that we can notify them using a text, let's say, send them to a place where they can see their incentives, and then to a place where they can self-serve themselves to answer these assessments and get an incentive while you're also helping the engagement of that member. So you really need to find all of these things or have available all of these things so that you can start tracking the preferences of your healthcare consumer population and reaching out to them in ways that works for them. And you can see where the initiatives Tricia talked about earlier can be met with a process like this in the bubbles above. Next slide. Let's go in and talk about how it works with Campaign Manager. So some of those items that I just talked about, such as live chat and video chat, really wouldn't be served with an automated campaign management tool. Those are solutions that a member could have available to them to reach a care manager and create that bond and trust. But there are other mechanisms that you can use, such as texting, email, links to educational material, and other means that we're describing here in the second bullet that can be automated. So if you're running rules, let's say, in the system to determine who has the need for a foot exam in a diabetic population 30 days from now, to be able to use a tool inside of the population health management solution that can leverage those cohorts of healthcare consumers and send texts, emails, mail, use smart AI technology for other chat boxes and other solutions that can really drive that engagement while you're linking it with closing out quality initiatives and getting those needs met. So instead of having a bank of nurses trying to call people and remind them of an appointment, you're using these other mechanisms, and over time, your solution can get really smart about what it uses from one patient or one healthcare consumer to the next, because you'll see what they respond to. You'll start to learn as a system how to manage different messages to different folks for different conditions. And as the system learns more and more, and you're tracking those, the competency of each of these messages, you can start to leverage these automated solutions in a very powerful way to not only meet quality metrics, but to start lowering the cost of healthcare in the U.S. Let's take a look at the next slide and just show a little bit of Campaign Manager from a solution perspective. So to take these cohorts of healthcare consumers that can be derived through something like a care reminder rule set, you need to be able to create campaigns from those, view them, sort them, filter them, add content for each mode of communication. So if you're looking at texting, to be able to send text to those that prefer that, send emails to those that prefer that, and manage that within a solution that's really designed for a member of the care management team or the care coordination team to work with. We have really tried to separate it from the process of rules creation and defining of these healthcare consumer cohorts and creating a campaign manager on top of that for a different user that really understands the clinical needs of those populations and can read those preferences that are available in the system to really start to take ownership of the various campaigns that go out and measure the possibilities and the outcomes over time. So again, the purpose is to put this in the hands of those who work very closely with the care management staff to automate some of the outreach that is very difficult to do by phone as we have traditionally tried to do. Next slide. So as I said, these cohorts are created with using one mechanism, which is the Sentinel rules engine. This is the heart of the Jiva platform. It is used to define healthcare consumer cohorts and also drive workflows. It also includes things like auto approval for UN. So to be able to use a rule set like care reminders or some of our identification and stratification rules to create pools that you can then layer a campaign manager capability on top of to send the right communication at the right time is something that we feel like can be a very powerful add to our platform. And I think over time, we'll be able to even add the ability for a Jiva user to just manually drag and drop healthcare consumers into predefined campaigns, use those registries, as Sandra talked about, to slice and dice cohorts and create campaigns for those types of members as well, so that you have a manual way of generating these cohorts. There's a lot we feel like we can do with this capability. And the combination of care reminders, the proactive outreach, and something like Campaign Manager, which can automate that and increase the reportable touch points that our customers have with those healthcare consumers, can really be a win-win for everyone involved. So that concludes my portion. I would like to turn it back over to Tricia now to summarize our webinar and to close us out. Tricia?
Thank you, Matt. I just really want to drive this home. It's National Healthcare Quality Week, and that's really why we wanted to get together and acknowledge the intent of this week, but also showcase some of the work we're doing at ZeOmega to advance the needle with improving healthcare outcomes, cost, and consumer and clinician experience. And we're focused on this because it's important. It's what's driving the value-based care movement across the country and the globe. There's some staggering statistics around preventable and avoidable causes and medical errors. The medical errors are the third leading cause of death in the United States. And when we look at medical errors, we should be looking at it more broadly than something very acute. Missed care, things that were intended to be carried out but weren't, are considered an error. And so many of these things that we're talking about regarding gaps in care, when they're not carried out, it's unfortunate. It can be considered an error. It's not delivering the service and interventions to members that they're supposed to get. And so when that happens, disease processes progress, low risk cohorts move into higher risk cohorts, and the outcomes and cost suffer. And so this is all related and really requires everyone to kind of join together to fix this global crisis and engage with our members and our consumers differently and help them focus on wellness and behaviors and health maintenance in order to improve this great opportunity we have as an industry. The last bullet on this slide is one that I find the most insightful, and it's that research is showing that more people are dying from poor quality of healthcare rather than the lack of access to healthcare. And so we talk a lot about access, but unfortunately, when we can get folks plugged in to having access, but the care that they receive is poor or error prone or not complete, or delivered in a way that doesn't actually enhance value, it can be worse than not getting it at all. So, improving the status of healthcare, again, requires all of us to engage in addressing it as a global crisis and raising it as a priority. That translates into the need to invest into tools and resources that enable us to do the right thing, deliver the right care to the right person in the right way and at the right time. So the very last slide here is just to wrap up. Again, we are honored to acknowledge Healthcare Quality Week. Kudos to all the healthcare quality professionals at ZeOmega and worldwide. I'd like to sincerely thank Ms. Sandra and Matt, and thank you for listening to this and taking the time out of your day to learn a little bit more about what we're doing and what we have to offer. If you already happen to be a customer of ours and would like for your organization to hear more about the information we've discussed in this Quality Week webinar, please do contact your account manager. Otherwise, you can email us at sales@zeomega.com, which is listed there on the screen. Please follow us on LinkedIn and Twitter. We appreciate your time and really hope you have a great rest of the day. Thanks again.